And he started that, and then he sold it to Joey Leone, who was from here. And then Joey left last year, and it was sold to Chase Hammy. Okay, you love, okay, that's so much. Okay, so that makes my heart so happy.
He's great. Love him.
And I love what he's done. So like my boys were part of the environment.
He knows my brother.
Yeah. Okay. What's your name?
Ellis.
Ellis, yes. Okay. And he's doing ortho, right?
Yes.
And so I think my daughter is kind of into ortho.
Yeah.
Yeah, but I don't think she understands how
Case is
broad it is. So he bought Silver State and now he has Gold Rush South and Gold Rush North. And I love it. My daughter's traveling this weekend at Women's Nationals. Last weekend, or 2 weekends ago, she went with him to Iowa. She went to Chase to Iowa. And they have Ed Sergani, who was up here with
He went to high school with me.
Okay.
We're the same age.
Okay. And I've had issues with him in the past, but I also. Yes, yeah, but I also see tremendous growth.
Yes.
He has found awesome mentors.
I think Chase is great, but it's one for him.
I think Chase is just a great human as far as I can tell.
Stand up.
Good son.
Like
to
a good human, good wrestler.
Yeah. And right now, Gold Rush North is being coached by Tony Salvate. He's probably I totally cheered against him in the backstage cheer because when you're lost all this was wrestling my friends, they friends. So I feel terrible.
Let's stand
for
let's stand for the Pledge of Allegiance.
I'm gonna say.
I
pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. This is the portion of the meeting devoted to the public. The public may comment on any matter that is not specifically included on the agenda as an item. Items not included on this agenda cannot be acted upon other than to place them on a future agenda. If you wish to comment, you can do so in person at the meeting or use the raise your hand feature in Zoom. *9 if you are participating via phone. Public comments are limited to 3 minutes. Please avoid repetition. The chair may, at his discretion, hold comments until the second public forum at the end of the meeting. Public comments submitted prior to 4 p.m. the day of the meeting will be provided to the board and added to the record, but will not be read during the live meeting. Any input received after 4 p.m. the day of the meeting will be included in the input, but may not reach board members before action is taken. Is there any public input? If you are speaking at the podium, please print your name on the sheet. Roll call. Present Sharon Hawley, Jackie Lavoie, Lisa Callahan, and Jordan Hicks. Is there any public forum? None at this time. 1.4, possible action, approval of agenda. I would like to move item 2.7, updates from subcommittees, to the first item for discussion. Do we have a motion to approve the agenda?
Jackie Lavoie, for the record, I move to approve the agenda with that move of 2.7.
Is there
Sharon Hawley, I second it.
all in favor?
Aye.
Aye. Motion approved. 1.5, possible action, approval of minutes. I have 2 minor corrections on the previous minutes. 1.3, Nevada's Aging Disability Service, it says stated she would like to attend a future meeting. And item 3.5, updating the existing newsletter, that was updating the existing resource guide. Other than that, I don't see any other corrections.
Jack Lavoy for the record. I move to approve the agenda with the corrections that Chair Callahan just mentioned.
Minutes.
Excuse me, minutes.
Second. I'll second that motion. All in favor?
Aye.
Motion carried. Moving on to general business, starting with 2.7, updates from subcommittees. And we'll start with Jackie Lavoy and communication.
Jackie Lavoy for the record. We can start this portion of the communications subcommittee with a presentation from Pinnacle Medical Group, and we have two ladies here to present, so come on up.
Good morning. My name is Jennifer Garrett, and I am a nurse practitioner with Pinnacle Medical Group here in Fernley. Pinnacle Medical Group has actually been around in the Reno area for the last 5 years, but we opened our Fernley office in December, and we're really excited to be here and participate in the health and wellness of our community. Let me see if I can get the clicker working here. Oh, great question. Thank you. No, it was not. There we go. The first question that we really want to talk about is, what is primary care? We find ourselves at a turning point in this country where a lot of times people aren't able to get primary care, so they end up going to urgent care. But we want to change that, and we want to make primary care offices, or at least our offices, the first point of contact for primary care and improving the health of our patients. We do this by focusing on prevention. If people can get their vaccines, their health is going to be improved. We also want to make sure we're focusing on early detection. If people can get their mammograms, we can find those negative health conditions early and prevent them from having negative long-term impacts on our patients' health. We also want to focus on the conditions that we can't make go away. Congestive heart failure, COPD, diabetes, those aren't going to go away, but we can help manage those chronic conditions so that they stay as less impactful as we possibly can keep them for our patients. We want to develop those long-term relationships and partnerships to help improve our patients' longevity and their life, and not just have them depend on us for sick visits. We want to be our patients' home base for their health care. And why does this matter? Primary care matters as we age so that we can stay independent and stay in our homes. People that are healthy are able to engage with the awesome activities happening in their communities. We have so many of them in Fernley. Our 25th year is going to be phenomenal, and we want to make sure we're helping our patients be able to engage with those. We want to coordinate our care with specialists. We have a very special partnership with a lot of our specialists, and we want to make sure that we're connecting our patients to the best opportunities to improve their health. We want to make sure we're managing their medications and making sure that we have good lab values so that we can make adjustments as we need to for their health care. We want to reduce the number of hospital visits that our patients experience and stop those trips to the emergency rooms, which are both painful and miserable, as well as expensive. We want to prevent small issues from becoming big ones. One of the primary ways that we do this with Pinnacle Medical Group is through our relationship with a new organization, a new branch of our group called MA Core Partners, or MACP. And we are going to focus on those annual wellness visits, which are so important to our senior population. That's not going to be a sick visit when they come in and we take care of the sniffles or a sore throat or something else. We're going to use that to really connect and direct our plan of care to take care of the patients, again, for the longevity so that they can have an improved quality of life. We want to strategize what's next for our patients. We're going to review their medical history. It's a once-a-year visit. We're going to review any changes that have occurred in the last 12 months, the previous 12 months. We're going to do those risk assessments to make sure that we're collecting any data and getting that early detection piece managed. We're going to take care of some things that change that we're not always able to get a good grip on, such as cognitive risk and fall risk assessments. And we're going to develop a personal prevention plan to keep our patients out of the hospital, in their homes, and again, engaged within our community. And that's how we keep our health goals. That's how we achieve our health goals. And this is how our primary cares offices manage that. We make sure that our patients get their annual wellness visits. We make sure that we manage their chronic conditions. We make sure that their medications are reviewed and safe. With your primary care provider managing everything, we can prevent those accidents where multiple medications from the same medication classes are ordered, and sometimes there's a little bit of an interaction, and we want to stop that. We also make sure that all specialist referrals are taken care of and that the preventative screenings are implemented. So what's covered? And this is really where it gets important, because we know that our seniors are on fixed incomes, and we want to make sure that medical costs are not damaging to their lifestyle. We want to make sure that they get their annual wellness visits. We want to make sure that they get their cholesterol checked, their cancer screenings, and their diabetes screenings done. We want to make sure they get their vaccines, flu and pneumonia, all of those kinds of things taken care of. There's always new ones on the horizon, so it's good to keep in touch with your primary care provider for that information. We want to take care of those chronic conditions such as COPD and diabetes, and make sure that we're keeping them balanced and as least impactful as possible. And we want to make sure that the highest level of prevention is implemented. Most of these things are free, and our preventative disease management things are very low cost. Then we get into managing our chronic conditions a little bit. Chronic conditions don't go away. We can only kind of hold them at a baseline level. And sometimes they do get a little bit worse, and we have to adjust our expectations. Again, as a primary care, as a partnership in your healthcare, we want to help you make those adjustments, adjust medications, adjust your needs. And again, the primary three that are seen in this population: congestive heart failure, diabetes, and COPD, which are very impactful over the patient's ability to get out of the house and enjoy some of the activities, especially the fun ones we have going on in Fernley. Then we're going to take care of medication management. Sometimes certain drugs can interact and have a negative impact on other systems. We want to make sure that we're monitoring that and keeping track so that we can stop those interactions from happening and prevent them from having negative impact. We want to simplify medication routines, because taking a medication 4 times a day, while sometimes it's necessary, can be hard to remember and hard to get completed. Then we also want to make sure we are we provide some help managing multiple prescriptions, making sure that people take them at the best times, with the best foods or without the best foods. And we make sure that people maintain that health and through their medication. And we want to make sure that you're only taking the things that are necessary. One of my favorite things as a primary care provider is being able to take someone off a medication, because generally they feel better. We want to prevent those hospital visits, and that's something we really emphasize through our partnership with MACP. We want to get people in earlier so that they have fewer complications. We want to make sure that they have fewer trips to the emergency room. Let's face it, the emergency room is there for a reason. I can suture in the office, but sometimes you want someone better than me to do that. And then we also want to make sure we give people peace of mind that they have someone that supports them in their health journey. And convenience really does matter. We know this. Our I-80 corridor is getting worse by the day with accidents and complications trying to get to and from Reno. So we want to focus our focus at our office is focusing on same day or next day appointments. We have made great strides in utilizing telehealth visits to improve the health of our population. We have access to online scheduling. And then we are local. We're right in the middle of Main Street and by Dyson Duels and 7-Eleven. And we have a great ability to get people in easily. And then we want to encourage you to participate in your health. You are why we are here. So we make scheduling easy. We want you to attend those early yearly visits. As a senior citizen, we want to make sure that everyone's getting their annual wellness visit. And we also want to make sure that they're checking in with us annually as well, not just for their Medicare visit, but for just a generalized check-in. We make sure that people have the time to ask questions and they have accessibility. If they can't get their questions or they forget something in office, we have a telephone encounter system in which they can send us messages that way. And it really provides additional opportunity to help them understand why we're doing what we do. We also like to have honest conversations. I can't necessarily take things away. I can't necessarily make certain diseases go away. But if we have honest communication, then we're able to actually make positive change. I would much rather have a smoker tell me that they're going to continue to smoke, knowing full well the risks that it creates, than have them lie to me and then I miss something that I could implement preventative to provide early detection. We also want to make sure we're monitoring those medications because it can be a really dangerous source of interactions. And again, you guys, our patients, are really the cornerstone of our work and what we do. So we like to really develop those relationships. How do you know when to see the PCP? How do you know to call and make an appointment? Anytime there's a change in energy or weight, if there is a new pain or discomfort or it's changed, if you're experiencing a medication side effect, such as dizziness, lightheadedness, falls, anything that feels off. And when you have sleep or mood changes, those have a dramatic impact on patients and the ability to do the things that they need to do for their life. And there are some really big common misconceptions, in particular in our rural setting, because it's so hard to get into the primary care office. There are so few primary care offices in general. People think they only need to go when they're sick, and we don't want that. We want to see our people to be able to engage in that preventative care and really help them focus on meeting their health goals. We also have that misconception that specialists are enough. While specialists are amazing and they're an integral part of our healthcare team, they are focused on their area. My job as your primary care provider is to make sure that I am providing holistic care and I'm not just incorporating what's happening in your cardiac system or your pulmonary system. I'm also worried about your mental health and how that impacts everything. So if the primary care provider is participating, we can really make a big impact that way. And I see people all the time that think it's too late to improve. It's never too late. Even one less cigarette a day has a big impact on your life. Even if you're a diabetic and you have one less sugary snack and change it out for a protein-based meal, that has a big impact. And we want to make sure we're reinforcing that to help create those better relationships. Our goals of primary care, we want to help you live longer. We want to help you feel better. We really want to keep people independent and engaged in our local area. And we want to reduce the number of visits to the hospital in the emergency room and the stress about those healthcare decisions that you have to make every day. At Pinnacle Medical Group, we are working on trying to help create this great relationship. We have a really big partnership. We are trying to help everybody engage and live their best life. And that's us. You can see from the QR code, that is one way that you can practice online scheduling. We are located right by Dyson Duels at 805 East Main Street in Suite A. We have some great partnerships with amazing specialists around the region. One of them being Alpine Basin Care, which is another local business also providing wound care, which is huge for our population. My name is Jennifer Garrett. I'm in office Tuesdays and Thursdays. I work with Elizabeth Peterson. She's a PA who is not joining me today because she's in office today. She's there Wednesdays and Fridays. And that's it. Does anyone have any questions for me?
Lisa Callahan, I do have a question for you.
Yes.
So is Pinnacle Group just a local medical group, or do you have like offices in other parts of the state or other areas? I mean, how did this come about?
That's a great question. So we have a deep relationship with Prominence Health Plan, which is part of the reason we've moved out here. We have 5 offices in the Reno area, and we have Carson City, and then we're our 7th branch to be open. We've been around for about 5 years.
Okay, that answered my second question, was about the insurances, the local area Medicare, which is sometimes difficult for, seniors to find, the care provider that accepts the Med Advantage, insurance.
Absolutely. That can be a huge challenge. And I actually heard a rumor yesterday that Prominence Health Plan was leaving the area, which is absolutely not true. We are deeply embedded in the healthcare of Northern Nevada and focused on the rural community.
Thank you.
Jackie Lavoie, for the record, I have a couple of questions. Do you take walk-ins?
Well, yes, but we usually get a phone call. Yeah, one of the cool things that we're able to offer at this point is if you are a Pinnacle person, a patient of a Pinnacle provider in the Reno area, I don't want to take you away from your primary care provider because that's a deeply personal relationship, but you can come out here. You have to be established to be able to do the walk-in procedure, but absolutely.
I was just curious if someone, got bit by a dog or something, instead of going and sitting at Renown, if they're part of your group, they can just come in and have that treated.
We've actually had that happen. Getting bit by a dog can be extreme, but yes, absolutely. We've actually had a few of those start to develop. It's an exciting piece of our practice.
My other question is, you mentioned holistic care. Can you talk about that a little bit more?
Well, I think it's really important. I'm duly certified as a family nurse practitioner and a psychiatric mental health nurse practitioner. And I went that route because I found that a lot of times the enormity of the healthcare issues that people find related to cardiac or pulmonary systems makes it hard. That it can really be overwhelming to their mental health. So in being a psychiatric mental health nurse practitioner as well, I'm actually able to kind of address those mental health needs, which in my perfect world makes everything a little bit easier, right? We can make sure that we're getting we're combining things so that you're able to manage the enormity of that cardiovascular need and dealing with the pressure that it can put on the emotional system. We're one big being, right? We have to look at things from a holistic perspective. Again, urgent cares serve an amazing role within our community and prevent hospitalizations and trips to the ER, but they are going to focus on one thing at a time. Even when I'm focusing on that person that comes in with a dog bite and one thing at a time, I'm also going to address those other issues.
Thank you. That's all I had.
Thank you.
Okay, Sharon Holly, for the record. Now, if you're not with an Advantage plan, can you still come in?
Absolutely. And we have some documents that actually have a list of our accepted insurances. You can go onto our website. There's lots of opportunities to check all of that out. I can't keep track of it. There's a lot of them.
Lisa Callahan, I have one more question. You were talking about being as the primary care person, dealing with the coordination of medications and specialists. Now, some seniors see a lot of specialists and they could be on a medication from each specialist. And each specialist is prescribing that medication. So what you're looking at interactions, you're looking at potential things, but do you actually change, or do you go to the specialist and say, what do we do?
I'm not necessarily going to change it unless it's threatening, but I'm going to participate in a dialogue, right? Where I share with the cardiologist who, because cardiovascular disease continues to be the number one killer of adults, that's the easy target, right? I'm going to work with a cardiologist to figure out why you're having a side effect. There is a lot of collaboration that happens behind the scenes. But as a nurse practitioner, as a primary care provider, that takes me out of other elements, right? Like I'm not able to manage some of the other pieces. A lot of our senior citizens within the rural community fall through the cracks. I'm going to focus on making sure that those cracks don't exist. And we have a whole team at Pinnacle that focuses on that.
Okay, good. Thank you.
And Jackie Lavoie, lastly, we were talking before the meeting
Yes.
started about a health fair that you want to put together. So please just make sure and let us know when that is and whatever we can do to help promote
Absolutely.
that. Okay.
We are trying to finalize a date, and there's a huge struggle with trying to find an adequate date. We had talked about trying to do it in conjunction with the 4th of July and being able to utilize that 25th anniversary momentum to try and get there, but it's hot. So we are actively working on a date that really maximizes the potential for our patient population.
Thank you very much, Jen.
Thank
for
you.
coming, and we'll be in touch with your health fair and possibly newsletter and senior resource guide.
Thank you so much.
Okay. Another item, Jackie Jordan, update on the senior newsletter.
Jackie Lavoie, for the record, I think we're still waiting for someone's staff to be connected with us for the newsletter so we can work on, whenever we can have someone on staff assigned to us so we can work on the next newsletter.
So before Lisa Callahan, so before the meeting, April mentioned that our committee will remain under the city clerk's office. So Kim, how does that work?
So we will reach out to the communication or the resource committee. What committee is this? I'm sorry. Okay, Jackie and Jordan.
Right.
And we will get that going for you.
And Jackie Lavoie, for the record again, so I'm assuming that since city clerk will be our connection, that will also work on the resource guide with you, the modifications that we'll be discussing here shortly.
So it's the resource. I just want to make sure that I capture everything. The resource guide and the newsletter. Okay.
And Lisa Callahan will be discussing the resource guide later in the agenda. So,
Okay.
Okay.
And then Jackie and Jordan, maybe after this meeting, we can have just a little meeting just to kind of figure out how we go from here. Okay, thanks.
okay, sounds good. Lisa Callahan, Partnership Committee. I was expecting Cecilia from Nevada Aging and Disability. We're trying to work with them, coordinate what they can do to help us, here in Fernley. I will reach out to her again and reschedule for another day. Also, kicking off Older Americans Month, there will be a senior resource fair at the Reno Senior Center, May 1st, 10 to 12, 9th Street Senior Center, if anyone is able to go. I'm planning on attending unless something comes up in the meantime. But May is Older Americans Month, and there'll be a lot of opportunities for information for seniors. Okay. Okay. Anything else on subcommittee? Sharon, do you have anything? Gordon? Okay. Moving on to item 2.1.
Madam Chair,
Yes, Councilman Torres.
we're gonna do a presentation. I just I just talked to Miss Swanson for Older Americans Month at one of the two council meetings in May. So if all or any of the members of the SCAC can attend, we'll let you know to receive that proclamation.
Okay, that would be great. Thank you.
Good morning. April Hami, City Manager and Mayor's Office for the record. If we're ready, I'll provide an update on the planting day.
Yes, we are ready.
Okay, so as most of us already know, that is Saturday, April 18th. It'll be at the Fernley Desert Memorial Garden Cemetery located at 1000 Mission Way. We do have St. Robert Bellarmine Catholic Church volunteering. And Jackie, if you could give me the contact or provide me with the number for the volunteers, that would be great. We also have Just Serve. They're providing some volunteers as well. And Bonnie Holiday should have that number to me by Tuesday of next week. So basic overview of what we've done already. A couple weeks ago, Randy and I burned a lot of the debris and the weeds and the dead bushes in that area that we'll be working on. Our main focus of concentration is going to be at the gazebo and the surrounding area there by the flagpole and the east side. On the east side, we've ordered turf. We'll be laying sod, so we have some greenery there on both ends. And also we'll be planting the flowers in the 4 planter boxes. Those are very small though, so it won't take a lot of flowers for those boxes. They're 2 by 3. And I do have a list that I'll provide to you right now of some suggestions because we'd like to stick with native plants to this area so we don't have to worry about them dying off, and we do have color throughout the year. I would also like to schedule time with whoever is interested from the board to go out and shop for those flowers next week so we can have prior to the planting day.
Thank you.
So if any of you can commit to either the 14th or 15th next week to do some shopping, that would be great.
14th or
14th or 15th. Either day works. If you'll just email me and let me know or give me a call if you're interested.
okay.
So we'll divide up into 1 to 4 teams. The event starts at 8 o'clock. Parks and myself will be there probably around 7 to get everything set up. We'll have drinks on site and some snacks for the volunteers and staff. 8 o'clock, we'll welcome the volunteers. They'll check in. We'll provide an overview of the day's goals, the safety reminders, and assign the teams and the volunteers. Team 1 would spread the mulch by the flagpole areas, north and south, that back area, and pull any weeds or do any trash cleanup that needs to be done in that area. It does look pretty good right now, though. Looks a lot better than it did a couple weeks ago. Team 2 will lay the sod on the east side. And I believe that the mayor is going to prep, he's going to have the sod laid out already so it can just be rolled, was my understanding per our meeting yesterday. And then Team 3 will plant the flowers in the flower boxes donated by Trex. There's 4, they're on each corner. There's also a bench on each corner that is permanent. We still have the benches in the shed that were donated from Trex, and we will move those out anytime someone has a service there, so they have somewhere to sit. We didn't want to keep them all out there though, because then we'd have to tie them down or do something, and we didn't want to compromise that cement pad there. And they're pretty light, so we can just bring those out whenever they're needed. And then if we have enough volunteers, the next team would just pull weeds and clean the surrounding area, and they can move all the way to the west because that area that we're focusing on is a pretty small area. So if we have a lot of volunteers, we're going to knock that out pretty quickly. I don't know if you have time prior to the event, but you might want to go out there and check out the new road that Parks just installed. It starts on the large rolling gate when you go in to the cemetery. They went from south to north halfway around the cemetery until they ran out of money. And their intentions are to finish that up in the next fiscal year, but that made a huge difference. Now there's a road you can actually drive on partially through the cemetery. The budget for this event is a little over 3,000. It's about 3,300. Soil and sod, not sod, soil and it's going to be about $60 for the boxes, the flowers and plants. About 250 work gloves. We'll provide those for the volunteers, water, Gatorade. That's a couple $100. And then the sod is around $2,700, and that comes out of the cemetery's budget. And about 11:45, we'll do the kind of the final cleanup. We'll collect all the tools, the gloves, make sure that everything is loaded on the parks trailer. They'll have a big trailer out there for the trash and anything else that we can just stack it on, and Parks will be assisting with that as well. Today, after this meeting, I will email you all of the contacts for that day, cell phone numbers, myself, Randy, and Dalton. If you have any questions that day prior to, or you need something else, just give us a call and let us know. Are there any questions?
Lisa Callahan, when you're going through the cost of items, how much are we spending on flowers?
Flowers, we have set aside around $250.
Okay.
And then work gloves are $150. We have some on site, but we're going to purchase another 15 pairs just so we have enough for all the volunteers. And then water and Gatorade, you're looking at about $23. And then the sod is $2,700. That's the largest part of the budget is the sod.
Okay.
Jack Lavoy, 2 questions. One is, I know that you always provide tools like rakes, shovels, those sorts of
Yes.
things. What about hand tools for planting the flowers in the pots?
We do have those here on site already, and we'll be bringing all of those, the rakes, the shovels, the trash bags, the trailer, and the hand tools.
Okay, okay. And then I kind of spaced what my second question was. So if
That's
if
okay.
it comes back to me, I'll ask.
Sharon, for the record, so we can tell you what day we could do it, to go to shop for the flowers.
Yes, I'm open the 14th or the 15th.
I could do the 15th, but not the.
You
Yeah,
can
I
either-
could do the 15th, I believe also, so.
Yeah.
Okay. On your pages with the flowers and the bushes and things such as that, on the last page, I just wanted to call out that you'll find a couple of trees Those are the Shade Master maple trees. On the second phase of the cemetery, we would like to start looking at colorful trees that are hardy and that will provide some color there as well. So we'll be reaching out to get your input on that, what you'd like to see back there, because there aren't any really large trees there right now that provide shade behind the gazebo. And also Parks this week, they will be prepping the area for the sod, but they'll also be installing and replacing the irrigation. So all of that will be ready to go on the day of planting.
Any other questions for April?
Madam
Thank
Chair.
you. Those trees are beautiful.
Yeah, they
know,
are
that's-
gorgeous, and they, you know what, there's two different types, and the colors are beautiful in the fall with those maples.
Madam Chair. Kim
Yes.
Swanson here. Councilman Torres has a comment.
I can't, okay, I
I-
couldn't see.
yeah.
That's all right.
I can't see you over there.
I'll be there on the 18th,
Okay,
just so you guys know.
okay, thank you.
And then whatever you need, just let me know.
Okay, thank you.
Any other questions?
Okay, thank you, April.
Okay, thank you.
Madam Chair, before we continue, can we go back to 2.7 where you were doing the updates with the subcommittees? Because Cecilia from ADSD is on and would like to make a comment.
Oh, yes.
Cecilia, are you still there? Cecilia, are you still there?
Here.
Go ahead.
Oh, okay. Is this in regards to the public comment?
Yeah, when you raised your hand in regards to where they were doing the updates with the subcommittees.
Oh, no, I'm sorry. I raised my hand earlier in with a public comment, but I can wait until the end to do my public comment.
Whatever.
Okay, you want me to go? Sorry. Good morning, members of the committee. So my name is Cecilia Alonso, and I serve as a Northern Regional Coordinator and Tribal Liaison for Nevada's Aging and Disability Services Division within the Department of Human Services. And so I thought I was scheduled to present to the committee today, but ADSD programs and services available to seniors in Lyon County area. But I do look forward to doing that at your next meeting. I also am here today because I feel like these community matters are important and I wanted to show up regardless. I think I also wanted to share within this timely opportunity that the Nevada Task Force on Alzheimer's Disease is currently in the process of reviewing and updating the state plan on Alzheimer's and dementia plan. And so I wanted to kind of bring this information forward because this is a chance to make sure that Lyon County's voice is part of that conversation. The task force will be meeting on May 19th at 10 a.m. and public comment will be open. As the date approaches, the meeting link will be posted at our adsdnv.gov website under councils and commissions. So I wanted to encourage anyone here who has been touched by Alzheimer's or dementia as a patient, caregiver, or family member to attend and share your community needs. Thank you for your time, and I look forward to being back next quarter.
Lisa Callahan. Thank you, Cecilia. We will get you scheduled for the June meeting, which I believe is June 12th. And thank you for the information for May 19th on your task force on Alzheimer's and dementia.
Thank you.
Okay. Moving on to 2.2 for possible action discussion and updates pertaining to the Business Expo on April 18th, 2026. So as it turns out, it's the same day as Planting Day. The expo is 1 to 4. So April has gotten with Jessica and our table will be pretty much ready to go when we get to the expo. And we're hoping to have some fans to give away at that expo, but to date, I don't know if we've received any fans.
April Hami for the record. To date, we have not received any fans. I did receive a phone call. Ooh, excuse me. And I do have someone who said they will be dropping off some next week. But they're not here, so
Okay.
we'll see. And also on the fan drive, is there a solid date where you'll be distributing in May like you did last year? You did it 2 separate times?
The solid date is June 12th.
June
Was
12th.
June 13th. Our meeting's the 12th. Now I'm thinking, but June 13th, that's Saturday. And we'll discuss that when we get to that agenda item. But we kicked off the fan drive last year with fans at our table at the Business Expo. And it brought some attention to the fan drive as far as more donations and just making people aware that we were giving them away and we would be giving them away again in the month of June. Now, Jordan created a new flyer for the fan drive, which he has, and I believe sent to April for printing. Is that?
I believe I'm waiting for a contact on that.
We have a
Flyer?
contact on it now.
Is there a
Now,
contact? Send them over and I will print as many as you need for the Business Expo. And Jordan, I just want to say great job on those. They look beautiful. You did a fantastic job.
Jordan's
So-
for, oh,
Okay, sorry. Not knowing really who to put for contact, we put you, April. Do you want us to change that to clerk's office or?
Yes.
Okay,
Yes, please.
so why don't you make that quick change and then go ahead and send that to Kim.
George Hayes for the record. Yeah, thank you, April. I appreciate that. So when I sent it back on April the 3rd, but I think you had it out of office that day, but I made sure to CC Jessica. So even though that you didn't receive it, because I think you was out that specific day, I made sure that to CC Jessica, because I remember you told me to do that. So she might have it. You probably didn't see it just because you was out that day, but I did update it with all that stuff that I was told to, and I made sure to email it to her. But I made sure to make this new change and update it to the city clerk's office to reflect the current information that we got now. So
Perfect.
I appreciate that.
Thank you.
Okay, so at the Business Expo, we'll have flyers, we'll have our business cards, we hopefully will have fans. We've got a new tablecloth. So we should be set to be able to come from the planting straight to the expo and participate in that. So anybody have any questions about the Business Expo? Okay. Moving on, item 2.3 for possible action, discussion and updates related to the fan drive on June 13th, including donations, flyers and distribution locations. So we've got the flyer in the works. We need to talk about is distribution location. We're rethinking where we want to distribute the fans. So comments.
Jackie Lavoie for the record. I suggest that we do the fan drive as we talked about last year. We didn't because the clock was being worked on and with the remodel at Justice Court. But I think visibility is better if we do it by the clock here on the corner of Main and Silver Lace. And I think we also need to determine what time we're gonna do that, 9 to noon or something.
Lisa Callahan, I believe 9 to noon is good. I like the idea of moving it to the clock tower. My only concern is last year we had a bunch of fans left over and we had a place to put them. So I guess if we have fans left over, we'll just haul them. Well, is there anybody going to be here on a Saturday? So or we take them and bring them. The other thing was, it was very, very warm and we were getting relief from inside a business. So maybe we need to do shifts on this. We need to do something. I don't know what the weather's like between 9 and 12 on that corner where the sun is. But I know it was very, very hot last year is my only concern.
Jackie Lavoy, for the record, the business where it was done last year across the street at the Nest, so they had that fence up
Mhm.
and that, so that's not gonna,
No,
that wouldn't work. And Squeeze In had offered, but I feel like it's really isolated and not everybody knows to park around the back and how to get there. I think the visibility of that location is not really conducive.
yeah, I think the visibility is good. Being on Main Street, I think is a good idea. The other possible idea I came up with would be like in front of Black Bear as a possibility. And she's, has offered to work with us, Christella, on different things. So that's something to consider.
Jackie Lavoy, for the record, well, at Black Bear, at least if we needed to go in and cool off or use the restroom or something, we could do that. So I'm fine with the Black Bear suggestion.
I'm fine with Black Bear.
Yeah, I know, I'll reach out to Christella and see if that works for her and how that would work. Cause I don't know, because it is also the Nuggets, I just don't know how that coordinates as far as what we can do. So I'll reach out to Christella and find out.
Madam Chair,
Yes.
the city does have shade structures, the covers that we could provide if you have it by the clock or if you have it at Black Bear and you have it outside. We do have pop-up shade structures that we can provide.
Oh, that's really good to know. Thank you. So does that make a difference? And yeah. So if we want to do the clock tower and we've got a shade structure, then we can wave signs, fans.
Yeah. And there's plenty of parking.
And there is. Okay, so do we want to make a motion to for the second distribution of the fan drive? Okay,
Jackie Lavoy, for the record. So I move that we have the second distribution of fan drives on June 13th, 9 till noon, near the clock on the corner of Main and Silver Lace. And the city will give us some shade.
Sharon Holly for the record, and I second that.
all in favor?
Aye.
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 Okay, motion carries. So the second fan drive, June 13th at the clock tower with a shade structure. Item 2.4, possible action, discussion and updates relating to the ice cream social to coincide with Lyon County Health and Wellness Fair in May 2026. So I will at least reach out to Senior Center, Jennifer and Rebecca, about when they plan to have the Health and Wellness Fair this year at the Fernley Senior Center, if they have set those dates yet. And then as soon as we have that date, then Sharon, I'll let you know, and then you can talk to Steve about the ice cream. Last 2 years, he has donated 50 cups. Last year, we purchased an additional 100. It was way, way too much. So probably I'm thinking maybe purchasing another 50, I think would be plenty. Last year, there wasn't as big of a turnout as there was the prior year. And honestly, I think it was related to menu item. They were trying to be healthy. And I think it kind of backfired. So the demand for ice cream was less, but I'm going to talk to Jennifer about menu options also. So any other questions about the ice cream participation in the health and wellness? So do we want to decide now we're not going to meet again until after the ice cream social. So a motion on how many ice cream we're going to purchase.
Sharon Holly for the record. I think that, I'd like to make a motion to purchase 50. And then if it looks like we're gonna run out, we'll run over. Yeah, it's not that far.
Okay.
It's not a Tuesday, is it?
We don't know yet.
Oh, if it's a Tuesday, he's closed on Tuesday, so.
Oh, he's closed on, see, that's how much I know now, but
I just saw the sign.
I don't know what date
We're
it'll
having
be.
a conversation.
Till. Kim, did you want to say something? Okay,
I'm just listening.
okay.
Madam
Jackie,
Chair, if I may,
I'm sorry, I'm hearing voices.
potentially, has anyone thought about reaching out to Steve's Ice Cream for donations? Because they do make the ice cream sandwiches.
Steve has donated 50 cups the last 2
Okay.
years.
Sorry, I missed that.
Yeah, chocolate, well, we can pick our flavors, but we do chocolate and vanilla. And surprisingly enough, even to Steve, that chocolate is the most popular.
Okay. Sorry about that. I heard
That's
the
okay.
50 cups, but I didn't hear Steve's Ice Cream in there, so.
Okay, I'll second the motion that Sharon made.
All in favor?
Aye.
Okay, motion carries. Okay, item 2.5, for possible action and discussion on the status of the senior resource guide and obtaining bids to print.
Jackie Lavoy, for the record, I have made some suggested modifications to the resource guide based on information I had basically received from Sharon and Lisa. And I'd like to distribute these to the members here to look at and make sure I've got them under the right category. And if there's anything else to be added. And then once that's done, then Jordan and I can meet with Kim and work on that further. And I did find, I believe this is the last time we had ordered resource guides, excuse me, in November 2023 from Allegra. So I have a copy of their bill at that time, how many we got and the whole deal. So hopefully, once we get to the point that we're finalized and we're ready to print, I can reach out to Allegra and get an estimate from them. But they did good, quick work, and it was very affordable.
That's the one I
300
found also.
Yeah, $345 for 100 colored, trifold, whatever. So it was. So that's really all I have to about that, is
Okay.
to just to distribute to the other three the changes that I'd like to make or additions, and then we'll go from there. Do we have the authority, though, Jordan and I, to move forward once this has all been approved, or do we need to wait till the next meeting?
Sharon, for the record, I think we just need to move forward.
Yeah, Lisa Callahan, yeah, I think we could move forward and make a motion that we will, contact the printer and, with an approximate, amount of money that we're going to spend, and then be able to go forward.
There are two items, Jackie Lavoy, for the record again. There are two items that are to be deleted from the existing resource guide, and I think, Lisa, you may have been the
I
one who,
was.
Alzheimer's Support Group and Fernley Rotary Senior Kindness Program.
Yeah, the Rotary Senior Kindness Program has been eliminated. So they kind of will do like what they did for us last year at the fan drive. They'll make a donation somewhere related to seniors, but it became overwhelming to them to have to go clean weeds out of everybody's yard. So they basically shut down the senior kindness, with the exception of if you have a light bulb or a battery that needs to be changed. So it's not the same extent that it was. So I just felt like we needed to remove it.
And Jackie, for the record again, and what about the Alzheimer's Support Group that
The
you had?
Alzheimer's Support Group is now, and I think I added that on there, is now meeting at Fernley Estates. And I think I added that one in and removed the other one that was no longer meeting at that location. Let me see. Yeah, the Alzheimer's support group no longer meets at the senior center. So so Dementia Family Caregiver Support Group meets at the Fernley Estates twice a month. So basically this replaces this.
Jackie Lavoy for the record, and I bet we don't have Pinnacle.
I was just gonna say-
And
So I do need your contact information so we can add that to, I think we have one category that's general. Yeah.
we have healthcare.
Okay. So that's all I have. Jackie Lavoy for the record, that's all I have, right now. So I guess just email me any additions, changes, if I've typed numbers wrong or email addresses, and then I'll update this, and then Jordan and I'll get with Kim's office.
Okay, so do we need to approve an amount for the printing or Kim? I think,
I just have a question.
yes.
Do you remember why they weren't printed in-house
No,
before? Okay,
no, we actually don't. Originally, the first one was going to be printed like out of a place in Utah that Denise Mormon found, but then for whatever reason, they couldn't do it because it was out of state, but it was going to be a lot less. And then not sure where the Allegra came up with, but there was a couple of bids. Don't know who the others were. And then this just kind of happened, but no, we have no idea why it wasn't done in-house.
okay.
Jackie
I'll
Lavoy
look
for the
into
record.
that.
I'm wondering, could it have to do with the fact that this is really glossy and embossed? Does the city have printing capabilities for that? It's
I
kind of
think we
thick.
can just order that type of paper.
Okay, well, we can
Yeah.
definitely talk about that. Yeah,
Yes.
for sure.
Yes.
Okay, so anything else on the resource guide? Okay, good. Okay. Okay. Item 2.6, possible action, discussion and possible FSCAC participation in the 4th of July and the city 25th anniversary celebration. In the past, with the exception of last year, we've done a table at the 4th of July. What do we want to consider this year? Coordinating with the two events, any suggestions, ideas, table, don't participate?
Sharon for the record. I think it's gonna be a cluster out there because everybody's gonna be wanting to do something and, I think it's pretty hard.
Madam-
Thought.
Madam Chair.
Yes, Kim.
So there is a 25th anniversary committee, and I will send the schedule to you, Madam
Okay.
Chair, and then just invite a few members from the committee to join our
Okay.
committee.
Okay,
Yeah, I think we're meeting every other week now, and it's here at City Hall in the Public Works Conference Room.
okay, okay.
Yeah,
Thank
I'm
you.
not, the times I think have changed a little bit, but yeah,
8:30. 8:30 is typically when it
8:30.
is.
Yeah,
And we also have events starting on July 1st. So if you didn't want to attend the 4th of July, it's that whole weekend. So there may be other places for you to get involved.
Okay, okay. It's-
no, no,
So-
you're good.
We will see about, attending a meeting and discuss at the next meeting what participating might look like or not participating.
Jackie LaVoy for the record. So Kim, you'll email that information to all four of us
Yes.
about that 21st anniversary committee, and then we can go from there. Okay.
Yes, and there's lots of activities scheduled. So even if you just want to put your name, like help with one or two committees and, just like put your name with it, I think that would work too.
Okay. Okay, great. Thank you. Anything else? Item number 3, address requests for future agenda items. So I would say future agenda items will be Cecilia from Nevada Aging and Disability, and readdress participation in 4th of July or the city's 25th anniversary celebration. Anybody have anything? Okay. Okay, item number 4, is there any public forum? No public forum, and with that, meeting is adjourned. Very efficient.